Can lower back pain be trying to tell you something serious? Lower back pain, most people think it's just a strain, a disc issue, or aging. But what if it's something far more serious? Could your pain be sending a warning sign? Let's uncover the hidden dangers behind persistent lower back pain that many overlook before it's too late. Let's dive into the clinical vignette. A 60-year-old man came in with chronic lower back pain. The pain was vague, dull, and non-radiating, localized around the mid-lumbar region, around L3 to L5. No sciatica, no shooting pain down the legs, just this persistent discomfort that wouldn't go away. Sounds like a typical musculoskeletal issue, right? That's what everyone thought too. But it was wrong. With a long desk job and no major trauma, most assumed degenerative disc disease or mechanical back pain. He was treated for months under that assumption, but the pain never improved. He had no fever, no weight loss, no night sweating, nothing that screamed a systemic illness. But he had one small overlooked complaint: mild urinary symptoms. He had slightly increased frequency and a bit of discomfort when urinating, but nothing extreme. Since people don't usually link back pain with urinary symptoms, it was easily overlooked. Because at 60, BPH is common, so his mild urinary symptoms were seen as normal. His lower back pain was also dismissed as degenerative disc disease, another age-related issue. So doctors saw them as separate, unrelated problems, never considering they could be connected. But in reality, they were signs of something much more serious. And so the cycle of treatments began. He went through multiple acupuncture sessions trying to ease the pain, had massage therapy, painkillers, chiropractic adjustments, physical therapy, and even multiple injections, all aimed at a supposed musculoskeletal issue. But months passed and nothing changed. The pain remained exactly the same. Finally, after 5 months, someone ordered an MRI, and then everything changed. The MRI revealed metastatic vertebral lesions. His spine was riddled with cancer. But the real question was, where did it start? The answer? It started from bladder cancer. So it was a metastatic bladder cancer. The cancer had already spread to his lower back vertebrae, the true cause of his pain. This wasn't a musculoskeletal issue. It was bone metastasis. For months, everyone assumed it was just a common back problem, but that problem never actually existed. Meanwhile, the real cancer was silently progressing. This is why we must look beyond surface symptoms and always consider the bigger picture. Let's see why this happened. One reason is concept bias, a common cognitive trap in medicine. So, what is concept bias? It's when healthcare providers rely too much on familiar diagnoses, fitting new symptoms into pre-existing assumptions instead of considering other possibilities. It's a type of cognitive bias that can lead to misdiagnosis or delayed diagnosis. Now let's apply this to our case. The lower back pain, doctors assumed it was degenerative disc disease because at 60 that's common. The urinary symptoms, they linked it to BPH, another frequent age-related condition. They considered these as two separate, unrelated issues, delaying the true diagnosis. This video was created by Dr.H, an integrative health expert with a physician background and a clinical PhD in integrative medicine, with a passion for sharing insights on integrative health, from recognizing early disease signs to simple wellness tips. Stay connected for more.